Hi, Med Circle. It's me, Kyle. Welcome to class, Tuesday, May 10th. We're covering the topics in mental health, anxiety, and depression. You can't really have too long of a conversation without bringing up one or both of those topics. One of my favorite people, psychiatrist Dr. Christy Lamb, all the way out in Southern California, is here to unpack this for us. Dr. Lamb, wonderful to see you.
Thanks so much for having me, Kyle.
We're
Great
going
to
to
be here.
we're going to get to member questions certainly very quickly here. So if you have a question for Dr. Lamb and you're watching this live, submit your question below. But let's go into depression specifically. What a great way to start your Tuesday morning. Let's go into depression. Are there any personality traits that would make somebody more susceptible to depression?
So, I think that it's first and foremost, it's really important to say that anyone, all of us as humans are susceptible to depression. There are certain traits and certain ways of operating in the world that may predispose us to be more likely to suffer from depression. So before we can even talk about traits and kind of the psychodynamic side of things, it is also important to kind of separate out the two parts of any mental health discussion that we're talking about. And often with my patients, I'll talk about kind of the two hands of mental health. That one side is our genetics, our brain structure, neurotransmitters, electric circuits all in our brain. This is where medications, TMS, ketamine, all kinds of different treatments that are available for depression can be really helpful and can predispose us to be more likely to have a specific type of mental health condition. So some people are more kind of wired for or genetically predisposed for depression versus anxiety versus a subset of anxiety, OCD symptoms, or substance dependence. And so looking at that is really important to say, gosh, what's my family history? What are things that I might watch out for that are based on just kind of my temperament and how I was born? For better or worse, that is less malleable. We can't really work as much in that realm. Medications can be very helpful, but the place where we can have huge gains and really get to know ourselves is looking at personality traits and ways of being in the world, what I call psychodynamics, that are really malleable. When we can identify and see ways of operating in the world that may be making it more likely that we may dump into depression, we can gain some agency and feel like there's something that maybe we can do about this. So very often, people who have been raised in families where it was necessary for them to perform, be on, caretake, are going to be much more likely to have a predisposition to kind of dump into a depressive state. That if we think about the notion that if I was raised in an environment where I needed to be on and caretaking or be the good kid when there was another child in the family who was suffering with educational disabilities or health disabilities or emotional disabilities, there was this drive to have to perform. And often depression it can become kind of almost, if you can think of it almost as like a fatigue state. I'm either on and performing and doing, or I can go into a collapsed state where it's very difficult and it feels like the only way that I'm quote unquote allowed. And again, these are all unconscious processes to break, to be seen, to be taken care of is when I'm really shut down. And this mechanism is unfortunately very common. Unfortunate for the person obviously going through it, right? That this isn't something that they choose to do, that it happens, that it feels as though the way that I can survive in the world, be seen, be loved, be enough, is if I'm performing and I'm not allowed to take breaks. I'm not allowed to self-care. And a depressive collapse will sometimes come in and the person can feel completely debilitated. And it's almost like the nervous system is saying, this is too much. This is all I can take. So that's one really common trait that can put people as a setup for depression. Another one, as many Med Circle viewers may know, one of my favorite topics is anger. And
Oh, yeah.
unfortunately, the repression of anger is incredibly common as a mechanism that can result in depression. So for many people, if it's not okay to have a difference of opinion, set boundaries, be clear about not being okay with something, which is what anger lets us know inside our bodies. If anger comes up and we shut it down, often we get anxious and then can dump into a place where self-attack can be the way that we keep that anger at bay. So it's not the other person that's doing anything wrong. It's not a problem. I'm just depressed. I go into a numb, collapsed, self-attacking state, which is so common for depression, is this place of kind of like a wet blanket of isolation, hopelessness, a sense of helplessness. All of these things can come in. And when we think about it again, psychodynamically, it's almost like it's an act of love to the person that we may be having anger towards, that I'm not going to have anger towards you. I'm going to turn it back on myself and dump into this state that doesn't allow me to set a boundary or take care of myself. I'm going to protect you in this way. So these are some psychodynamic ideas around how anger can be perpetuated in regard to how we learn to operate in the world with other people.
Really well said. Let me get this simple question out. So based on what I heard, there are people who can live with symptoms of depression where the environment and context isn't as responsible as their own, I'm going to call it DNA genetic makeup for the depression. Do you agree with that?
I would agree with that in that, I think that if we think not so much in regard to like responsibility, that anyone who is navigating depression, that even the processes that are environmentally bound, the person is not doing this in a conscious way. They're not choosing to say, well, I want to protect this person that I love, and I'm going to dump into depression. Sure. And so I want to be very clear that I, in no way, shape, or form, want to say that this is a choice, that people are doing this consciously or willfully.
Right.
So to make sure that that's not the case. And then absolutely, I think that there are predisposing factors that can make people very prone to depressive episodes. That being said, in my clinical work, outside of a tumor, abnormal labs of some kind of organic internal kind of biological situation that's going on that could perpetuate something kind of completely out of the blue. Very often, almost always, what I see is that there is something going on in the environment. And then because I have a genetic predisposition to that, the place where my feelings get transmutated is into depression. For some people, it's numbing into substance use. And so it can be very helpful. And for some people, actually brings a sense of hope when, if we really look a little bit deeper, we can see there may have been something that was driving this, because then that means we've got a bit of a roadmap. Yeah. It's not just lightning that strikes out of nowhere. It's that there was something that got triggered and resulted in this kind of depressive episode or depressive collapse. I was working with a woman actually just yesterday who came in saying she's just been feeling more depressed. She doesn't really feel like she wants to get up in the morning. She hasn't really had a sense of meaning and purpose. She has a career, has children that she loves, but has just been feeling kind of blah and down, and has had depressive episodes in the past. And as we started to get a little bit more clear about what was really going on, it came out that she is bending over backwards for her children she's sleeping on the couch so that they could have their own rooms. She is working really hard to get them things that they maybe otherwise couldn't really afford. And there's some resentment building. And so when we got clear about the feelings that she was having, she loves her kids so much. She has a ton of guilt because in the past she had some substance dependence issues that had made their life chaotic earlier. So she has this drive to kind of take care of them. And as she started to notice, yeah, I think I actually am having I've made my children a bit entitled and I'm getting a little
Mhm.
bit resentful. I haven't been setting boundaries. And rather than feeling any of that, she was getting anxious and really kind of dumping into this is that mechanism of kind of anger getting turned back on the self, that she
Mhm.
was not allowing herself space to set boundaries, to get clear what she wanted. And none of this was she privy to until we started really exploring. It just felt like this depression had come out of the blue.
Yeah.
And then as we started to get a little bit more clear about what was going on, we could see that there was actually a trigger to this. And that so often we can look to where we might be dropping our self care and why and what's driving this so that we may be able to work our way back out.
Great illustration. We're going to move into anxiety, but I want to take a hard right turn into this question. By
Sure.
any chance, do you have any knowledge on how foods can impact depression?
So I'm certainly not an expert in regard to kind of there's a huge growing body of evidence in regard to functional medicine and the overlap with psychiatry, the gut biome, and
Well,
how
what's functional medicine? What is that?
yeah, so functional medicine is looking at the nutrients in our bodies and how our body is actually functioning in totality. So it's a really holistic way of looking at our physical and mental health. And so a lot of functional medicine doctors will do a lot of work and lab work to look at micronutrients, looking at what the gut biome, so the good
Oh,
bacteria, the
I
bad
need this.
bacteria, yeah, and so they're doing some wonderful work as far as getting clear about um, what may be affecting us in regard to what we're eating, allergies that we may have to certain foods, things that we may have certain reactivities emotionally to different foods. And again, I think that this is something that's bi-directional. I think that's really important and what I mean by that is it's important to keep in mind that I have never had a patient and there may be case studies out there about this where it's literally just what I'm eating that's causing these symptoms. And so it's
Mhm.
multifactorial where I may have a propensity for depression. I may have life stressors going on, and then I may eat things that cause a worsening of my symptoms and make me feel more crummy. And unfortunately, often when stress is up in the midst of depression, cortisol levels go up. We often crave things that aren't necessarily going to make us feel the best. And
Oh,
so
yeah, isn't that the truth?
that nutritional component plays a huge role. You know, when I think about helping people in regard to getting clear about kind of, I used to call it the wheel of wellness, and I'm sure I stole it from somebody, but I call it the lamb wheel of wellness. And there's medications, there's therapy, but there's a whole component of other self-care things that play a huge role. So things like exercise, nutrition, especially in depression, sunlight, social engagement, a sense of meaning and purpose. So there are lots of different ways that we can help support ourselves, even outside of access to care in regard to meds and therapy that can be really important for helping us feel better.
Yeah. Well, on Kyle's wheel of wellness, it's a big old Diet Coke today, so there you go. Let's, move on to this topic of anxiety. I know what we're gonna get into, but I'm not gonna do any spoilers. Dr. Lamb, same question. Are there, personality traits that can make someone more susceptible to and I don't even like to say to anxiety because hello, we all have it. We all
You
have
got it.
anxiety. So when I'm referencing anxiety, I'm referencing debilitating anxiety, anxiety that is in the DSM as a mental health diagnosis. Yeah.
Mhm. Yeah, so just like with depression, there have been some beautiful brain studies that certain structures in the brain that are bigger or larger may predispose us for anxiety. Our hormone levels, cortisol levels, brain structure, neurotransmitters, all of those same things that can affect depression can also play a role, obviously, in the predisposition for anxiety. Again, those two hands of mental health. There's the biological piece, and then there's the temperament piece. And for many of us, Anxiety, as Kyle mentioned, is absolutely a healthy adaptive thing that comes up in our body, that if we can look at it as a signal flag, lets us know there's something important going on, either a threat to our physical body or a threat to us emotionally. And often with generalized anxiety disorder, panic disorder, these disorders can become debilitating and become clinically relevant when this anxiety is feeling like it is affecting our capacity to function in the world, affecting our social engagement, our careers. And that's where, with the DSM, our Diagnostic and Statistic Manual, in regard to categorizing what is a disease state, it's really about a level of impairment in your life. That being said, I think that it's really important for us to see this as a spectrum, that low levels of anxiety, if we aren't allowed to notice and regulate and attune to ourselves and then understand why the anxiety came up, we just ignore it. It gets higher and higher to a point where we can be in that clinical state where we're less functional, we're not doing as well overall in our lives. And so it's so important that we start to understand even low levels of anxiety and understand that this can become exacerbated through life stressors, those kind of things. But most importantly, if we don't learn to first notice, attune to, and then understand what's going on in regard to our anxiety.
Are there any I want to go into the thought loop. This idea of a thought loop doesn't, we haven't actually put a label on it at Med Circle. So can we talk about what a thought loop is and then how it would relate to somebody struggling with anxiety?
Absolutely. I mean, I think that I would suggest that one of the worst and most debilitating thought loops is the primary cause of unregulated anxiety. So, one thought loop that I see very, very commonly is that as people are starting to look at their anxiety, they get more anxious and start self-attacking and
Yes.
worrying about the anxiety. And it's as though this bully starts to turn on a megaphone and says, oh, why are you anxious? Or this is not going to get better. It's only getting worse, right? And these thought loops that just get worse. And then the anxiety does get worse, right? Because we've got a bully yelling in our ear saying,
That's right.
you're a freak, or it's only going to get worse. And then the anxiety goes up, and then the thoughts get even louder because, like, see, told you. And right. And this escalates. And so noticing when we are in that place is first and foremost the most important thing, that we can notice there are those thoughts. We can build some distance and start to allow ourselves to just notice the thoughts that are coming up about the anxiety. Because if I am trying to regulate my anxiety with whatever modality is useful, whether it's breath work or muscle contractions or grounding, if there is a bully yelling in my ear, it's most likely going to be less effective. And so we first have to address those thoughts that are keeping the anxiety regulation that we're working on from actually working. The analogy that I often use is that the anxiety is like a fire that we're trying to put out with regulation exercises or whatever we're doing to intervene. Lots of great things we can do to help regulate our anxiety. But if someone is behind you and putting lighter fluid on the fire, you're doing some breath work, like, blowing on the fire, and there's lighter fluid coming in, those breaths are not going to take hold. They're not going to start to calm down the fire. So we really have to work to notice those thoughts, see them for what they are. And then when we can see it and have some separation, we can, it's okay. We're good. We're going to give this breath work some try. Yeah, it's not going to work. Well, you know what? I'm going to give it a try here for a second. Just take a seat, thoughts, right? And I can allow myself to engage in whatever the exercise is.
First of all, are you wearing what ring is this? An Aura ring?
I am.
That's what I'm wearing. An Aura ring. We're Aura twins.
We are. I love it.
So if somebody's in this, or if somebody's having these thought loops, is this something that they could look back and go, man, I've been in this habit of these thought loops since I was a child? Or is it something that comes much later in life?
Absolutely can start very, very early on. And unfortunately is sometimes modeled for us, sometimes with a harshness of like, why are you so anxious?
Yeah.
Sometimes even with a loving intention, a parent or a caregiver may have said, don't be anxious, right? No, 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 you're fine. And then the sense is, I'm not allowed to be anxious. So
Right.
one of the first things that we have to do when we notice our anxiety is to attune to ourselves in a loving way. And that may have never been modeled for us. So this is where, when we're talking about anxiety and saying, I want to address this, I want to take care of myself when this anxiety comes up, we really have to ask, am I willing to come in compassionately with curiosity? Or do I have to come in as a bully? Because if I'm coming in as a bully, I'm going to undermine all of my efforts. What I have to do is be able to come in as a loving friend to myself, as a loving parent to myself, to be able to say, wow, I'm really anxious right now. I can notice it. I can pay attention to what I'm noticing physically in my body with love and with ways to then potentially attune and bring that anxiety down, to be able to say, it's okay. Let's take a deep breath. It's all right. Right. But if those thoughts are coming in, it's so important that we allow ourselves to see that. And then once we quiet the bully, right, the next step is saying, can I come in and notice and pay attention to myself without that bully coming in immediately? And I was working with somebody last week who we were talking about this internal bully. And it was amazing how sneaky the bully would come in at different ways. It's like, yeah, that bully is awful. We should not do that. But why am I so messed up that I have this? And I'm like, good. You see how the bully just came in a sneaky way?
Through the back
And
door.
the
Yeah.
right. Sometimes it's harsh and mean. And then sometimes it's the non-curious question that's really like, why are you so crazy? Which is
Mm-hmm.
still just a self-attack. So we have to really be vigilant to watch out for these thoughts that are coming up, notice them, and a clear commitment to taking care of ourselves again in a loving way, which can be really hard. If we're not used to being gentle with ourselves, being kind with ourselves. And so it's something that I also always want to kind of warn people that notice the internal pushback. That as we're saying this, it sounds good on paper, like, yeah, I want to be kind and compassionate and curious with myself. But when you actually try to do it, there may be some pushback. You may start to feel that bully start to come in, and noticing that is so important, because then once we notice, we have choice. Once I notice that this is coming in, I can say, okay, wait. Okay, my old way of being is to just attack myself or to just try and push through my anxiety. I know what I want to do right now is be with myself. I want to take a breath. I want to calm this. I want to do this in a loving and compassionate way. And there's often an internal struggle about, do I actually want to be in this space with myself? Most people want to just push through.
Yeah.
But we can learn to gently and slowly cultivate that capacity for self-compassion.
I think, first of all, I'm terrible at this. Oh my gosh. There are some things that I have rocked out with Med Circle. I go, ooh, I like that. I'll apply it and it's great. And it wasn't that much work. This, I'm bullying myself literally, but I'm just not good at this. My bully takes over.
It's hard.
It's so hard. And one mistake that I make, I think, is doing these exercises in higher stress situations rather than finding lower stress situations where I can practice it,
Such an important point.
Yeah.
Yeah, the analogy that I often use is the the basketball arena. That if I am going to try and do something on a regular basis that I really want to master, I'm not going to start doing it at like the championship game with crowds screaming. I want to go into the quiet gym and I want to learn dribble, dribble, spin, follow through. Dribble, dribble, spin, follow through. That I can hit it every time. I can breathe. I can do a muscle relaxation. I can ground in a quieter time, so that when the arena is full, or in this analogy, right, my anxiety is really high, I can pull on this in a very easy way. Unfortunately, many of us don't notice, pay attention to, or regulate our anxiety at lower levels. And so we don't have the opportunity to do that work. And so that's something I highly recommend to all. I had one woman set her watch for every 30 minutes to check in. What do you notice? If it's at low levels, no problem. What can you do to take a deeper breath or relax your shoulders down? To just practice noticing and attuning without judgment and not in a flooded space. So I think what you're saying, Kyle, is so spot on, and it's so important. I think the other thing that can really play a role in this is that for many of us, myself included, we can be kind of wedded to our anxiety. We, as crazy as that sounds, um, anxiety, the physiological symptoms of anxiety, sensations of anxiety are similar to excitement,
Mhm.
to an adrenaline rush. And
Get
that
that.
there's an interesting study called it's a kind of a law that was done after a bunch of scientific studies. It's called the Yerkes-Dodson law, and it's a bell curve that basically says at low levels of activation or anxiety, our level of function is pretty low. If we're totally disengaged and like drooling on the couch, we're not very productive. As anxiety goes up, it's also about engagement, excitement, activation levels. Our performance goes up until we hit a spot where those of us who navigate anxiety, there's a point of diminishing returns. We go down that bell curve where more and more anxiety, again, we're less and less productive. So there's a sweet spot of activation and starting to look and get to know ourselves and being able to see where that spot is and ways that I might misattribute like healthy activation, or gosh, anxiety gets me going or gets me to get stuff done, right? That toppling over on the bell curve can come pretty quickly, and
Yeah.
noticing, do I need to be in an anxious state or be hard on myself to feel like I'm productive, and is there maybe a different way?
Right. Right. Well said. I remember that. What did you call it? Yukon bell curve?
Yerkes-Dodson law.
Yerkes Dobson law. All right. Um, because depression and anxiety, so many of the symptoms do manifest as behavior,
Mhm.
which a lot of people tie to personality traits. I want to spend some time talking about how we as individuals can tease apart our personalities from our mental health disorders, not only in ourselves, but in others. I'm an
Sure.
introvert. I love being by myself. When I lived in LA, there were times where I go, "Oops, it's been 5 days and I haven't seen anybody." And I'd have to go, "I gotta go, schedule an appointment with a human being so I can see somebody." And it's not because I was depressed, it's because I was an introvert. Yet there are times where I'm depressed and I don't see anybody for 5 days. I know the difference, but I think for a long time I didn't, and I know a lot of people don't.
Absolutely. Yeah, I think that the choice is the big piece here, right? And so
Mhm.
being able to, I'm always going to be talking about building and observing ego. Can I see myself and work to be curious to understand, where am I? If I'm feeling super great laying in bed, reading a book and avoiding other people by choice, that's a very different place than I'm depressed, I'm lonely, I feel debilitated, I can't get out of bed, and I don't want anyone near me right now.
Mhm.
Right. So, how we feel in that moment is really important to assess, and being able, like you said, that in the past, it was hard to kind of differentiate, and that now you kind of know the difference. And this is that space that's so important about looking in and about getting to know ourselves. Again,
Mhm.
without judgment, we can come in and say, no, this feels actually really good. Or I feel so crummy and I don't want anyone around. Okay, I know of me, this is a different place. And this is a space where I might need to start using some of my tools to schedule to go hang out with somebody, to get up, go outside, even for a short bit,
Yeah.
check my nutrition, do the things of self care to see if I can help improve my mental state. But I think what you're saying is so important, that often people get stigmatized for things that aren't actually depression, that are
Yeah.
just temperamental, or I'm an introvert, or whatever the case may be. And sometimes we miss the overlap and something that could dump into depression. And being able to tease these out are so important. And that means being able to look in, and get clear, how do I feel right now? Do I feel
Mhm.
great because I'm doing an art project and holed into my house and
You're
making
right.
yummy food and taking care of myself? Or do I feel awful and hopeless and stuck and, in that depressive kind of state?
Where this gets more difficult is parents with teens, because I'll ask doctors, Well, how do you know? And they go, well, a big indication is when a teen's behavior changes drastically and they start sleeping more. And I go, yeah, that's what 14-year-olds do. So that
Right.
how does a parent really engage with their child to go, hey, are you just being 15 or are you depressed? Do you need help?
Right. And it gets very complicated, and especially because with hormonal changes and
Oh,
social growth and brain development, right? Teenagers can kind of have these kind of depressive dumps or things that are ebbs and flows that are kind of within the normal realm of being a teenager and adolescent maturation. That being said, I think that one of the most important things that we can do for our children is to help educate them about building their own self-observing ego. So the
oh, love
idea
this.
of at a very young age starting to help them, and you know, this is something that really with really young kids, you can start with just food. This is what I do with my 4-year-old. Are you full? How do you know? How wonderful that you stopped eating because you paid attention to your belly because you didn't want to get a belly ache. Wonderful. You're having a tummy ache. Are you hungry? Do you think that you're hungry? What are you noticing inside your body? Is it grumbling? Do you feel like you have to go to the bathroom? That we can start to pay attention to our bodies and be able to have this capacity to notice. So a teen can then say, Mom, I'm just tired. I was up all night studying. Of course I'm
Yeah.
sleeping. I'm a teenager.
Yeah.
Or can say, I feel really low. Now, this is a tough thing to cultivate, especially you know, it takes a lot of time for the teen to be able to build, for a kid to be able to build this observing capacity. And adolescents don't often want to share or open up or talk about these things. But preemptively being able to discuss about mental health, being able to discuss about the ebbs and flows of what it means to be a teenager and how hormones can change and moods can change, and starting to cultivate language around this can be really helpful.
Hmm.
Um, Outside of that kind of communication, unfortunately, we do kind of go back to what is their level of functioning. So just sleeping more doesn't necessarily mean a problem. But if they're sleeping more, avoiding their friends, not engaging in their activities that they otherwise enjoy, um, isolating more, right? This is where we start to get more concerned when we're talking about behavioral change. We're talking about often disengagement. So disengagement in life in certain ways, disengagement. So just disengagement with your parents as a teenager is normal.
Hmm.
Disengagement with the stuff that you love is definitely a sign that we might be looking at something more of a depressive episode.
Really great. This term highly sensitive person, have you heard of this?
I have.
Okay. So is this is not a clinical term though. This is come out of, or is it?
It's not in the DSM, but it's definitely a characteristics that's being talked about a lot. And there are some parts of the DSM that might kind of insinuate that this is the
Got
case.
it.
You know, if we talk about it just in layman's terms, we're talking about someone who has high access to the emotions that come up inside of them. So rather
That
than
that seems
someone
like such
who
a positive spin on highly sensitive person. Because when I hear that, my bias is like, oh, this is something I don't want to be.
So, yes, I will absolutely be transparent about my bias on this because I think I'm kind of, I lean towards this. And so, my positive spin is that I think it's kind of a superpower.
Hmm,
And
I love
as you
it.
know, Kyle, one of my kind of missions, I think, in life is to destigmatize emotions.
Mm,
That so many of us, myself included, have been raised that our logical mind, our conscious thinking, you know, prefrontal cortex, that is priority, that is the most important, and that our feelings are just kind of messy and get in the way.
no
And I
question.
would suggest that if we buy into that, we're losing out on a massive amount of unconscious data that helps us guide our way in the world, know what we
Hmm.
like, know what we don't like. And that's our emotions. That our
Hmm.
emotions are picking up on things unconsciously that we don't even know they're picking up on, and bring up a feeling inside of us. As we've talked about before, you know, with anger, I can show you a picture of something that would make you angry. And before you know consciously that you're angry, your amygdala is going to fire 200 milliseconds beforehand. That
Hmm.
it's like this, you know, very, very highly attuned detection system that if we can learn to trust, we actually become more rational, more grounded, more clear about who we are, what we want, that when we can integrate our emotional selves and our thinking selves, I would suggest, and again, take this with a grain of salt, it's coming from a shrink, but I would suggest that that is actually our highest level of functioning. And that people who are, in quotes, highly sensitive, have a lot of access to feeling. And what comes to mind is, of course, because I have a 4-year-old, Elsa from Frozen, right? That she's got this superpower that can feel really destructive. But when she understands it and sees it as a magical power and understands how to use the information from it and how to rein it in and how to navigate it, it becomes, again, a superpower. And that our emotions can be that way when we give ourselves access. Now, without that, it can feel like a flood of emotions, and it can feel like too much stimuli, and learning how to navigate that is a really important thing.
Yeah. Sports metaphor and a Disney metaphor today, Dr. Lamb. We're going all over here.
Do what I can.
This highly sensitive person I like the take you have on that. And I can add that a big downfall in my life has been my inability or unwillingness or avoidance to engage in my emotions. It is really not as much as I've gotten older, but certainly in my younger days, it really impacted my romantic relationships, because I was I was not raised to think with my logical brain. I was forced to.
Right.
Like, this is how
Most
you
of us are,
think
right?
through the world. Yeah.
Yep.
So very, very interesting way to look at that. Now, I'm going to read this verbatim so we can get it actually how it's supposed to be read here. Today's workshop is focused on actual walkthroughs on how to disrupt thought patterns from depression or anxiety. And we've linked to our series and past live interviews on treatment for depression and anxiety below this live class. But today we'll be focusing on hands-on strategies. So let's do an exercise. Let's say someone who's usually a hard worker is feeling depressed and unmotivated when they need to be productive. We've all been there. Can we walk through an exercise for, quote, working through this negative thought or behavioral pattern and motivating oneself?
Absolutely. Yeah. So, this is a really common situation, and speaks to kind of what I talked about before, as far as certain character traits of ways of being in the world that are common for major depressive episodes. Someone who is a high performer, who is who produces, who's there, and then a depressive kind of dump can come in. So first and foremost, always noticing. Can I notice these thoughts that are coming in? And so often what comes in is a sense of feeling stuck, a sense that I don't know who it was that gave this analogy, but I thought it was beautiful, that anxiety is often that you feel kind of stuck in a room, but you see a door. And so it's anxious. Can I get to the door? Can I get out of this? Whereas depression, the door either doesn't exist or is dead bolted and there's no getting out. And it's a sense of feeling really stuck and that there's nothing that I can do. And really pervasive often in depression is a sense of feeling helpless and hopeless. And so when we can start to tease out and notice those thoughts, we can do what Dan Siegel, who has a great book, Mindsight. I highly recommend it for anyone with depression and anxiety, of getting to know ourselves and how our minds are working, is observing these thoughts and seeing them for what they are and labeling it, right? There's no way I can get this done. The deadline's too soon. I'm a failure. I'm going to lose my job, right? Starting to notice those thoughts exactly for what they are and labeling them. That's a hopeless thought. That's a catastrophic thought.
But what if the thought is legit? You were supposed to turn in that project on Monday. It is Thursday. It's a big project. And you have the thought, I am going to get fired, or I am so lazy, I should have done that. And you're right, because you might get fired, or you are going to get fired. What happens when the thought is true, based in reality?
So I would suggest, here we go into the triangle. You knew it was coming.
Yeah, I know.
I would suggest that we always want to look underneath these thoughts. These are self-attacking thoughts. They may or may not be true, but they are used right now to torture ourselves, and they keep us from moving towards what we might do to get us out that door, to get some of this work done. So if I can notice those thoughts, I can let myself know, is this how I want to be speaking to myself in this situation?
Mm-hmm.
Is that a depressing thought? Is that a hopeless thought? And does that move me toward what I want to get done today, or does it move me away? And most often these attacking thoughts move us away and dump us further into depression. So if we can notice
Isn't that the
that,
truth?
we can get really clear. Then we can start to see, what are the feelings coming up? So if we work our triangle, right, we've got feelings, anxiety, defense. And I'm always talking about this triangle of conflicts that leads often to our symptoms. So
Mhm.
perhaps there's feelings towards my boss who gave me an untenable project. Maybe I'm feeling some guilt for not having done what I needed to do to stay on top of this. If I can allow myself to feel those real feelings without all the self-judgment, self-attack, guilt is a beautiful emotion that moves us towards action to kind of right the ship. Like, oh, I totally dropped the ball on this. What can I do to make it better? What can I do to make it right? That it's about repair, not about punishment. So if I can see all these self-punishing thoughts and I can question, right? Am I having anger towards my boss that's getting turned back on me? And do I need to address this and be able to say, hey, boss, look, I appreciate this is a huge project. The timeline really isn't going to fit, and I need to advocate for myself, set some boundaries, perhaps. If I'm feeling guilty, I can notice that and I can hold it and say, all right, what am I going to do from here to move forward? As soon as I move into that place of self-attack, I'm out of productivity and I'm attacking myself, and it will make the situation worse. So we have to be really careful about where these thoughts lead us. And when we can notice them, put them on pause and see where they're coming from, we can actually undo and come back to what's the stimulus, this project, and what feelings am I having about it? How am I feeling towards the person, towards the environment, and about my engagement with the project or whatever the case may be. And so noticing first and foremost, here are these thoughts. Are they moving me toward my goal or pushing me away? What kind of thoughts are they? Can I label them? And then in this process, we talk a lot, right, about compassionate stance, curious stance. I always like to give another maybe sports analogy here of when we're talking to ourselves, when we're in these places of distress, we have a couple different options. And for people who are anxious and who are often in a place of self-attack, there's often an internal monologue that is kind of like the punitive, harsh, mean coach who at the end of the game is like, you lost by 5 points. We're going back to the gym. You're going to run sprints.
Mhm.
I don't care how tired you are.
Mhm.
Work, kind of harsh and mean.
Mhm.
On the other end of the spectrum, there can be the coach who's like, meh, we lost. Let's go get ice cream anyway. It doesn't matter. Who cares?
Mhm.
Ideally, we're going to have with ourselves a compassionate, strong, and courageous coach who comes in and says, we lost by 5 points. Let's take a look at that. Our conditioning's down, definitely. So tomorrow we're going to start doing some conditioning. I'm going to go out there and run with you, and we're not going to do a marathon, but we need to up our game a little bit. We need to work on this. Go get a good rest, hydrate. We'll come back tomorrow and we'll get right back at it. Most of us don't find that middle space to where we can engage with ourselves, engage with our thoughts and how we're talking to ourselves in a way that is actually productive and moving us forward. And if we have one or the other of these two internal monologues going on, either push, push, push so hard, or screw it, I'm out, I
Mhm.
give up, right? We're going to be in a really difficult place. So finding that middle path that allows us to be kind and compassionate with ourselves, but maybe owning the fact that maybe I dropped the ball on something and maybe I need to stick with it. This internal monologue is imperative to start to understand, to start to see, so that we can cultivate the internal parent or coach that we want to be using with ourselves.
Really fabulous. What really got me was repair versus punish. So much of my internal monologue is now, through this conversation, I'm realizing is simply a self-punishment.
Absolutely.
And so you can say, well, you should have had that project done by Thursday, or we should have ran more to condition for the thing, whatever. And you might be right. But if it's coming from a place of punishment, are you really progressing? If it's coming from a place of repair, then you're actually progressing, which for me, that's what I want. Really fabulous as always, obviously, Dr. Lamb. That's the problem. When you're good so much, Dr. Lamb, the expectation doesn't go down. We go, well, you better change my life next time we see. um, Let's go to some questions. I'm going to try to get through as many as we can. Let's go to our first Med Circle member question. Is the medical field moving towards seeing depression as a more normal part of the human experience?
It's a great question. I'm going to editorialize here. Absolutely, I hope that this is the case, that the less that we stigmatize depression or any mental health symptoms that we're having, the more likely we are to be able to come in, again, with compassion and curiosity and try and understand why now, what can we do to help, as opposed to if we just make this something that is stigmatized and only certain people who are flawed in some way intrinsically are going to have depression, it becomes a very big barrier to accessing internal will for care. Because if I'm just intrinsically broken in some way, it's like, well, what difference does it make whether I intervene for myself or not? When we get clear that these are spectrums, these symptoms are often on a spectrum of the normal human experience, we can have more hope that there's something I can do about it. It's not that I'm just in this kind of broken box versus healthy box, that we all kind of run along this spectrum. And that's not to minimize in any way that some people suffer with depression that is really debilitating and, life-threatening in certain cases. So it's not to minimize it, but my hope would be to access some hope. Now, that being said, within the medical community and my own experience, psychiatric training has really moved towards a very biological model. Psychiatrists aren't really trained in psychotherapy. And so I'm not sure that the medical model is moving towards this, but I hope that these forums and places like Med Circle and all the work that mental advocates are doing can destigmatize, normalize, and create space for hope by explaining that, dips of depression and even major depressive episodes are part of the human experience.
Well said. Let's go to another Med Circle member question, please. This member is asking, if anxiety and depression are due to childhood trauma, then what type of psychotherapy is the most helpful?
Great question. And there have been lots of great studies around what type of therapy is the most useful, what's the most evidence-based. And I think that most major modalities of psychotherapy are working to kind of prove their worth with adding in more rigorous scientific studies to show outcome data. It's interesting, though, across the board, what we see is that it's really actually not about the modality of care, whether it's CBT or DBT or family systems or ISTDP, psychodynamic psychotherapy. But that's what's most important is actually the practitioner in front of you and the relationship that is created there, that we need to have a corrective experience. And whether that's doing worksheets with CBT or delving into the unconscious processes that were kind of created through childhood trauma, all of the above can be helpful, but sitting with someone who is compassionate, caring, connected, is helping make links, helping you build insight and creating space for you to be exactly who you are, feeling exactly what you're feeling. That's actually the most important ingredient in psychotherapy.
Fabulous. Med Circle has treatment or series on not all of them, but almost all of the available treatments out there, CBT, DBT, ACT. If you're trying to see if any of those move you in one way, I recommend watching those series. Let's go to another member question, please. Why are we having morning anxiety? I love this person. Why are we having morning anxiety? How are we able to break the pattern of morning anxiety? I've never heard of morning anxiety. And by the way, if you're listening, it's morning, like good morning, morning anxiety. Yeah.
Yes, AM, not grieving.
Yes.
Yeah. Yeah. So morning anxiety and late evening anxiety are both incredibly common.
This is a real thing, morning anxiety and late evening anxiety.
Absolutely. Now, these aren't diagnostic criteria, but
I know, but you knew exactly what this person was talking about.
Absolutely. So many people will wake up with panic or anxiety early in the morning. There are lots of different things that can contribute to this. And so one of the things that's really important is, again, that curious, compassionate stance to be able to start to look at what might be some contributing factors. And this is same goes for late evening that leads often into insomnia, anxiety at night. One of the two things about these two kind of opposite parts of the day is that they're often times when we are either alone or it's quiet and our thoughts are very
Yes.
present, especially in
Yes.
that evening, right? All the stimuli of the day that's had us distracted is gone. And now we're in this space where we're left with our thoughts and feelings, and that can bring up some anxiety. In the morning, since the question was about morning, same situation can come up. And there are lots of potential triggers in regard to, for some people, it's what they are about to approach in the day. For some people, it's tons of stress of getting the kids out the door. For others, it's getting themselves out the door and getting to work, going into a work environment they don't actually want to be in. For some, it's not having anything on the calendar for the day. And what do I do with myself? And getting anxious about a sense of meaning and purpose. We call it like existential angst of like, what am I doing with my life, and the anxiety that can come up with that. These thoughts may not be fully formed, and the anxiety may show up without having a clear sense of what it is. But with kind of looking in, sometimes with journaling or in individual therapy, we can start to see what the root causes are so that we can then address them, right? If I hate my job, I've had plenty of patients who woke up and vomiting, anxious, sweating because they just, had a hard boss, deadlines they couldn't meet, and were in a career that they really didn't want to be in. And their nervous system was literally telling them like, this is a no-go. And this is where that sense of sometimes that anxiety, if we see it as a signal flag, can be such a beautiful marker that says something in my environment is off here. I had one patient who was waking up with nausea, feeling really anxious and shaky. She also was struggling with food restriction. And we realized that her last meal had been at 2 p.m. So there was anxiety and there was other life stressors that were causing morning anxiety. But part of it was low blood sugar. She was feeling super crummy because she was restricting food. Lack of sleep can do this, right? So if we only have a certain amount of sleep, we are absolutely going to be more anxious, more likely for irritability, and feeling kind of crummy in our body. So there are lots of different factors that can play a role. And it is useful to think about even the biological pieces. So dehydration, lack of food, those things that we would think, okay, I've been asleep for this many hours. What could be contributing to this on an organic biological level is really important so that we don't miss anything there. And again, it's all these different pieces together that we kind of pull together to see what might be driving this. So first and foremost, I would say what comes up when you wake up? What are the first stressful thoughts that come up? And that's going to give you a clue about where we might be able to intervene to make some potentially, the patient that I was working with really got clear. This job is not sustainable and I need to start making steps towards changing. And as soon as those steps started to come in place, it wasn't like I walk in and quit my job that day, but starting to get really clear, this is not where I want to be in my life, and being able to start to take steps to change it. The anxiety was actually this really important marker that let the patient be able to kind of get clear about that and start to take some steps to change it.
Yeah. Really fabulous. I mean, gosh, I just learned so much just on what you said. It could also be too that I wonder if you're getting morning anxiety when you're on vacation, or morning anxiety on Saturday, or
Absolutely.
that
Great
could
point.
probably be telling too. Man, shout out to the people living with anxiety. I never really struggled with anxiety until COVID, and it was pretty brief. So I'm not like as familiar with what that life looks like when you're just chronically anxious, but I can't imagine waking up with that type of overwhelm. So if you're going through that, hey, I hope that was helpful, and we're with you. We're with you. It'll get better. Let's go to another MedCircle member question, please.
Cal, is it okay if we take just one, with that last question? I know part of it was, what do we do? And so I just wanted to add on real quickly that what you were talking about, of that sense of how do we start to incorporate the skills that we do, not just in the midst of crisis, that this is a great place to say, I'm going to start every day doing some breath work, some stretching, that no matter what is going on, whether I'm anxious or not anxious, if I know that the morning is a place where I can have this, I'm going to start to incorporate doing those skills so that I'm regulating my nervous system from the very beginning of the day. And I think that can be a huge piece of this as well.
Yeah, I love that. And I stopped doing it because I actually got the Aura Ring, but before I was bullet journaling every morning, and I
Mhm.
would track when I went to bed, when I wook up, not because I was, like, oh, I'm gonna control all my life, but because every morning it gave me this little activity that I could do before I
Beautiful.
checked all my emails. And it was also tracking self-care, like how much water did I drink, how much sleep did I get,
Yep.
and I loved that part. And then it went away when I got this ring, but I could see how that could help somebody start their day.
Absolutely.
Yeah.
Gratitudes, breath work, stretching, anything that gives you a pause to take care of yourself before you jump into the rest of your day can be really helpful. Yeah, I love that.
Yeah. Let's go to that next question, please, Bridget. If one's depression seems to be at the same time each year, oh my gosh, for example, August, would that be regular depression or could it be bipolar depression? Does cadence matter?
Great question. So, again, there are so many different factors that can play a role in this. So, for some people, a seasonal depression can have to do with how much sunlight they're getting, which can also contribute to how much socialization, how much exercise someone is getting based on the length of the day. All of those factors can play a clear role. We absolutely see a spike in manic behaviors or bipolar symptoms in the spring and in the fall in the change of season. But by no means is that necessarily a sign that this is bipolar disorder or the seasonal part of it, meaning that that it's on the bipolar spectrum. That bipolar disorder has very clear criteria where there are depressive episodes, but also either manic or hypomanic symptoms depending on where you are on the spectrum of bipolar disorder. So I don't want anyone who has kind of a seasonal depression feel like they need to go get checked out for bipolar disorder, because that's just not the case. That being said, I always come back to the therapy side of things and psychotherapy, and it is incredible. And there are lots of great books on this about, The Body Keeps Score is a great book that
Oh, yeah.
talks about this notion that our past traumas are often held within our bodies, and the memory system of the body, of the unconscious memories of certain things that happen. I've had some, almost seemingly bizarre situations where when we unearthed what was coming up around these times where depressive episodes were happening, that without even consciously thinking about it, it may be the anniversary of a death of someone who you loved. It may be, a graduation from college that then led to going into a career that you didn't want, whatever it is. That there are often anniversaries that unconsciously can trigger mood symptoms just by the date. And it may sound bizarre, but very often this is the case where we will see something correlated with, and it may not be a specific date, but it may be that, gosh, my dad was on deployment every summer. And so the summer coming brings in these memories and symptoms, all on an unconscious level the patient may not have access to. But the more that we can kind of get clear, what is this change of season, or what does this month signify? What does this bring up for you? The more we can start to unearth what was, or the traumas, and then be able to process the feelings that are around that, because it is trapped feelings that can get us anxious and have symptoms even moving forward.
Great question. I relate to that. Thank you for whoever submitted that. Let's go to another member question, please. Is there a way to short circuit anxiety that seems to come out of nowhere? Is there a way to short circuit anxiety that seems to come out of nowhere? If you don't know the trigger, can you still stop or dial it down?
Absolutely. And this is where I was so drawn to a kind of a body focused type of psychodynamic therapy, was my first understanding of anxiety as, through an education around this type of therapy, as anxiety as a physiological symptom in the body. And so when we think of anxiety, I often tell the story that, I had all of this training in philosophy and medicine and psychotherapy. I hadn't had much psychotherapy training, but in psychiatry, and was asked near the end of my residency, what is anxiety? And I kind of talked about thoughts and worry and didn't really know how to clearly define it. And when my supervisor at the time helped break down for me that at its core, anxiety is a physiological response in the body, it is not the thoughts that come up, then I had something to hold on to, so that even if I didn't quite understand what was going on, didn't understand why I was anxious, I could ground in and say, okay, I'm restricting my breath right now. I need to take a deep breath.
Mm-hmm.
Okay, I'm clenching my jaw. I can relax my jaw right now. Okay, I'm feeling kind of floaty. I need to ground in. Can I see 5 things in the room? Right. So I had very clear physiological understanding of what anxiety was in my body. And I knew that then I could have interventions to help regulate my anxiety. And this to me is, one of the most important things that we can learn about our anxiety is how it manifests in our body. And then accordingly, what do I need when my body is at whatever state of anxiety it's in? So if I'm really clenched, I'm going to need to take a breath and try and relax. If I'm feeling stomach upset and nausea, I actually need to clench my muscles to get into that lower level of anxiety. If I'm feeling floaty and dissociated, I need to ground in. I don't need to do a guided meditation to float off even further. I actually need to ground into the room. I need to get into my physical body. And the more that I can understand the sensations that come up with my anxiety, the more that I can intervene.
Yeah, I love that. Let's go to another MedCircle member question, please. What about being raised in a violent household with emotionally absent parents? Does this lead to anxiety and depression?
Absolutely. I would say this is probably one of root cause of anxiety and depression is that as humans, we are wired for feeling. We are wired to, if something in our environment is a threat, to feel some anger. If something is beautiful, we might have a smile come up and joy come in. If something is making us feel connected, we'll have loving feelings. If we lose something or someone, we're wired to emotionally feel grief or sadness. And if that was shut down at an early age and you grew up in an environment where there wasn't space for feeling, all of that gets bottled up, pushed down, and anxiety goes up. That physiologically, when you try and hold in tears, when you try and hold in anger, you tighten up to keep it all trapped inside. When that anxiety hits a point where it's over threshold, we either start to have panic attacks or we start to shut down. And that's where depression comes in. So we learn to shut down and hole in to not have feelings. Depression at its core is a state of numbness. There's such a huge difference that's so important between grief and sadness and depression. That depression is more of a void. It's horribly painful and distressing. But it is not sadness over this thing that I lost and I'm having a healthy grief over it. That's right. It is a much more isolative, disconnected, painful state to be in, and differentiating those is so important. And as kids, if we aren't taught and there isn't an environment to learn how to do feelings, we are, unfortunately, really in a setup for anxiety and depression. When violence is present, right, often the feeling of anger gets demonized as a violent act. These get kind of what's the right word? They shouldn't be connected, but the feeling of anger that comes up is intimately connected to violent acts. And so we then learn to shut down anger because we'd never want to be that violent person. When we're raised in an environment where feelings are welcome, anger is more than okay because we don't have to act it out. So there are lots of ways that we learned to operate around feelings that can really be a setup for the repression of feelings, increased anxiety, and regular dumps into depression. Because everywhere we go, we're stimulated to have feelings. Our nervous system is constantly on. And if every time a feeling comes up, it has to be pushed down, right? We're just, fueling the fire for anxiety and depression.
Yes, no question. Let's go to another question, please. Is that what meditation is about? Quieting the bully?
Yes and no. I think that we have to be very careful about setting ourselves up for unrealistic goals. That I know for me, I meditate, I go to therapy, I do all
right, tell me about your meditate. When do you do this?
So I read this great quote from, I think it was the head of Google's meditation. And they said, if you take one intentional inhale and exhale, you have meditated. Oh. And I loved that. And the idea that if you feel like you could sit for 5 minutes, sit for 2. So often at the end of, I'm one of those weirdos. I really enjoy working out. I like to exercise. I know, sorry.
Now I'm getting anxiety.
So for me, after I exercise, I will often sit with my feet up against the wall, and I will listen to, I happen to love Peloton. So Peloton 5-minute meditation or the Calm app, or I will just try and sit and breathe just for 5 minutes. So I am not a marathon meditator. The people who do these, weekend retreats and stay, I'm amazed and impressed. I don't know that that's something that I can necessarily do at this point in my life. But I do all the things, and yet I have a very harsh internal monologue that pops up. So the point is not to get rid of the bully. I mean, that would be great and enlightenment. If you figure that out, like, let me know.
Yeah.
But the point is more, can I notice? Can I first notice and give myself some space, which allows for choice? So if I see the bully in action, I can bring in my healthy parent who can say, okay, calm down. All right, I get it. Yep, we're anxious. It's okay. We're going to do a little breath work here.
Yep.
Let me take care of myself. I can bring something else in to help navigate. So I never want people, right? A great mentor of mine quote, I coined the phrase, right? This is not a purification process. I think it's so important for us to remember this, that in our work towards noticing and regulating our anxiety and navigating our depression, we think that we should be no longer having anxiety or having any depressive episodes. And if they come in, we've failed. This is not a purification process. So we are working towards progress, towards getting to know ourselves better, getting to see symptom reduction. And that if we are going towards a finish line, we're going to be disappointed and potentially back in that space of self-attack, not enough. And we're using our self-care to kind of attack ourselves. So I want to be really careful about that.
I'm writing down things you're saying. Yeah, no question. The amount of relief that I feel when I don't judge my depression is like so great.
Yeah.
Because most of the time I go, are you kidding me? We're doing this again,
Yep.
And I go, oh yeah, it's like a totally different thing. Sorry, let's go to more. We have so many questions. Let's go to our next question. But by the way, last week we did an inner child workshop with Dr. Judy. People went nuts over it. Okay, so if you've not watched that and you think it could be beneficial for you, go back. It's in your library. There's some top notes that I'm hearing from Dr. Lamb that came up in the inner child workshop. That's why I brought that up. Okay, let's go to another question, please. What can I do if meditation and SSRIs make my anxiety worse?
So super important to notice and really important to bring up with your practitioner. So not everyone does really well on SSRIs. And for some people, they need to try a different medication or may need a whole different class of medications, and that this is really unique and individualized. A couple things that I would say on the medication side of things. Number one, always let your practitioner know when things aren't working. I've had way too many patients who have suffered through and thought, well, I thought it would get better, and didn't tell me what was going on. And so they suffered through when we could have made some adjustments or changed things up. I think the other thing is that with medication, knowing that it can take a bit of time, so anywhere from 4 to 6 weeks to get the full effect of a dose and a dose change is important to know. So it may take a little bit of time. Let your practitioner know if you're having any adverse effects. And then the other thing that I see all too commonly, and this is especially with women, but can happen with men as well, is overdosing. And I don't mean like lethal overdose or anything like that. Right. I mean the dose being too high. Many people are what we would call slow metabolizers of some of these medications. And there are genetic testing kits that we can use to see how you metabolize different medications. And it has nothing to do with your diet or anything like that, but it has to do with actually a chromosome in the liver that processes these medications. If someone is a slow metabolizer, the medication is going to hang out in the system for a little bit longer, and they're going to be more susceptible to side effects or problems. And so those people often need a lower dose, and sometimes significantly lower dose. I have patients who go into their primary care doctor who's like, I think you're on a placebo effect. But when we did the genetic testing and we saw what the effect was when we actually pulled back on the dose, there was more of an improvement with less anxiety concurrently. Yeah. Some people are rapid metabolizers, meaning it runs through them more quickly. So they may be more susceptible to withdrawal, feeling more anxious when the medication is out of their system, and they may need a higher dose or twice a day dosing. So these are all things that you can talk to your practitioner about that may be contributing.
Mm-hmm.
That being said, on the medication side, lots of different options. Trying different classes of medications can be helpful. Sometimes the anti-epileptic medications can be helpful for anxiety. Sometimes the atypical antipsychotic medications in very low doses can be helpful for anxiety. So figuring out what works for you may be helpful. And then the other piece is, if meditation is making you more anxious, then we got to find a different way to help you calm your nervous system. And for some people, paying attention to themselves, again, brings this bully in like at full speed.
Right.
And so paying attention to your breath, that may not be comfortable for you yet. So it may first be paying attention to your environment. Can I notice what colors are in the painting in front of me? Can I notice these things? It's a little bit of distraction, but it's also starting to hone where I pay attention. And this is really what meditation is about. It's being able to notice how my mind is working. And if looking into my body, and people who have had a lot of trauma or get anxious over their anxiety, this can be very difficult. And so we need to be respectful of that and not try and just push through. For some patients, I've said, okay, rather than paying attention to your breath, can you feel your left pinky toe in your shoe? Yeah. Okay, great. Can you wiggle it around? Yep. Great. Okay, great. That's all the meditating we're going to do today. We're just attuning to building a capacity to being able to be present and notice your body, notice your environment. And sometimes we first have to ground before we're ever going to be able to do any meditative process. And it's not that you're failing. It just means that your anxiety may be at a higher level. And so we have to start with you where you are, rather than as if, you're just a little stressed, right? If you're really anxious, let's meet you where you are and attune to what you need in that moment.
Let's briefly go through some grounding exercises. If you could walk us through how we would actually do that in the moment.
Absolutely. So two of my favorites are, the first one is 5, 4, 3, 2, 1. And so we first think of, now, if people are having difficulty looking at themselves, this may not be the first one to do, because it is looking at our senses. So the first one is noticing 5 unique things in the room. Hearing 4 unique noises in the ambient environment, feeling 3 things against your skin, whether it's your hair or your shirt, and attuning to that. Noticing 2 things that you can smell. So maybe the shampoo or your laundry detergent, and then 1 thing that you may taste in your mouth. So this is a grounding exercise to get into the body and to notice our sensations. If that feels too intimate or anxiety provoking, sometimes grounding is just a distractor away to kind of connect, often with, it can be helpful with someone else, or you can do it yourself with an animal for every letter of the alphabet. So basically we go through an A for ape, B for bat, right? And trying to breathe as you go. That if I'm paying too much attention to my breath and that makes me anxious, I can distract myself with a grounding exercise and attune to myself to breathing. So I've got this distractor that allows me to potentially do the work. For patients that I have that are really highly, highly anxious and at that really elevated state, this kind of distraction and connection can be really helpful. I do things at the end of a session to close up. I'll just do this or that, chocolate or vanilla, mountains or ocean. That it takes us away from the bully and the internal thoughts and allows us to connect on something that isn't emotionally loaded necessarily, right? So I try and keep it pretty benign, but these kind of things can be helpful to distract away and allow our nervous system to come down a little bit, so that we're then in a place to do some of the other breath work or muscle contractions, that kind of thing, where we actually are in our bodies.
And how long should it last, the 5, 4, 3, 2, 1?
The process of doing it? Well, so I would suggest kind of going through it once, noticing how you feel. And if you need to go through it again, you can keep going through it until things start to regulate a little bit, until you feel a little bit more in your body. If it's not working and you're not feeling any improvement, I'd probably switch to something else. And so this is where there is no right breath work. One of my colleagues loves the square breathing, where you inhale, you find something that's a square in your room, inhale up, hold, exhale as you follow your eyes down, hold. I get confused and I get all anxious because I'm like, I think I'm doing it wrong. Am I supposed to be inhaling or holding? I hate that one, but he loves it. Whereas for me, 4-7-8 breathing is very helpful, where you inhale for 4 count, hold for 7, exhale for 8. So this is that getting into the gym in a quiet space to be able to figure out what makes you feel right. And at different states, you may need different things, and attuning to that is really important.
Yeah, understood. Let's go to another question, please. This member is asking, can addiction become a coping mechanism for anxiety and vice versa? Are there any practical ways to stop this cycle?
Absolutely. So I would suggest, and this is not necessarily everybody's take on this, I would suggest that addiction is almost always a coping mechanism. That substance use becomes a problem when it becomes something that I feel compelled to do because I'm uncomfortable in my current environment, which I would call anxiety. So absolutely, substances are most commonly used in order to regulate anxiety, whether the person is aware of the anxiety or not. In our treatment here at Bold Health, our whole focus is on anxiety and anxiety regulation, because we equate craving to being uncomfortable in my body as anxiety, right? And so if I can tolerate feeling uncomfortable in my body, and again, get to my physiology and help regulate, get clear about what might be coming up, then I'm not going to be as compelled to use. So I would suggest that when this dynamic is going on, it absolutely can become kind of an infinity loop where I use and then I feel crummy and I maybe feel some guilt about it. I get anxious and then I'm going to be more likely to use because I don't know how to regulate my anxiety and these feelings are making me anxious. So first and foremost, coming back to anxiety, this is a physiological experience in my body. Can I start to notice what I'm feeling and regulate and start to work to cultivate an internal regulatory system as opposed to going external and thinking I need something external to help regulate me? That is, again, not to demonize medication. Certain medications can be very helpful, but we have to be careful about really working to help people cultivate an internal regulation of their anxiety, which takes time and it takes hard work. But that's really going to be the biggest things that's going to kind of cut that tie of anxiety and substance use.
So let's pretend I'm your patient and I say, Dr. Lamb, I mean, every day when I come home from work, the first thing I do is grab a drink. I don't even think about it. I grab it. I drink.
Yep.
I know I probably shouldn't, but I go to work every day. My wife doesn't seem to care. I'm still a good dad, but I come home and I grab a drink absentmindedly every day from work. Are we cool with this?
As you may know, what I would ask, Kyle, is it a problem?
Yeah. So let me
I don't
say,
get to decide.
what if the answer is, well, I don't think so, but my wife thinks it's a problem, and so I want to fix it for her. Then what do you think?
Well, and I would say, gosh, if your wife thinks it's a problem, that's something that you guys could maybe work out in couples therapy, but I have to get really clear that you're my patient and I'm here to support you and your desires. And so if this isn't a problem for you, you're not going to have much motivation to change it. So it's only if it's a problem for you, would we need to look at it or explore it or need to change anything? So, I just have to ask again, whether it's a problem that you want to work on.
Right. Okay. And now new version of Kyle, super big problem. He so wants to work on this, but he's been doing this for 10 years. You come home, you grab a beer. You come home, you grab a beer. It is part of the life.
Yep.
What do you say to that patient?
Well, first, when I'm working with somebody who's starting treatment in regard to substance use, I want to make sure that it is a problem, it's their problem, and that they want to work on it. And so all of those things are clear. Then I want to help to build the motivational system. So often what I'll ask is, what consequences have you had? So how is it really a problem in your life? So that we can get really clear that motivation is, yeah, I don't want to wake up hungover all the time. Yeah, I don't want to get another DUI. I'm going to lose my job. Yeah, my wife's threatening to leave. Wow, those sound like really big problems. What's it feel like to get clear that this is what you want to work on for you? I'm really motivated. Fantastic. Can we look at what happens when you come home? What do you notice inside? And we'll just start to build an observing ego again of what's happening. What triggers us? Can we slow down the automatic process, just like the automatic thoughts or the automatic dump into depression? Can we slow down this process, be curious and compassionate, start to find out maybe there's some conflict with his wife. Maybe he hates his job. Maybe his kids are in a really tough phase right now and he's not sleeping, right? And
Mhm.
so that we can start to look at what's driving this desire to numb and help figure out how to deal with those issues. But first and foremost, in the moment when he comes home and this drive to go numb in some way comes up, can we just create a little bit of space, a little more and more space to potentially choose what if you went for a walk first?
Yeah.
What if you got to hide in the bathroom for 30 minutes and scroll on Instagram or whatever,
Yeah. Yeah.
so that you can decompress a little bit? How do we create just a little bit of space so that you aren't continuing to move toward the thing that you're saying you really don't want to do?
Yeah. Yeah. I get it. Let's go to another Med Circle member question, please. Can vitals like blood pressure and heart rate variability be reliable indicators of underlying anxiety?
So they absolutely will be not absolutely every time, but they absolutely can be a marker of anxiety, but it's not necessarily that they're anxiety. So we always want to be really careful. And this is where, unfortunately, with mental health conditions, so often people who have a mental health diagnosis don't get the same level of care within the medical system, because often it's like, oh, it's just anxiety. Oh, you've been in 800 times. And so we want to take those vital signs very seriously, get to know what's actually going on, get the full medical workup. And then, yeah, anxiety popping will increase your heart rate for people who are in the sympathetic nervous drive. So that's that fight or flight system. And that's kind of where anxiety first goes. For some people, interestingly, as the anxiety gets higher, the parasympathetic nervous system comes in and blood pressure can actually drop. Heart rate can actually drop. And this is where people are kind of flooded and can feel dissociated or fatigued. And that can also be a sign of anxiety. So it's not a clear marker to say, yes, this is absolutely anxiety, but it's something that we can use to help build the picture of what's actually going on.
Excellent. Let's go to another Med Circle member question. This member is asking, how does one go about disrupting anxiety attacks that seem to come on suddenly without obvious cause?
Yeah, I think that I hate to be a broken record. I apologize, but I think coming to the body is always going to be the most important thing that we can do if we have access to it. So, in the type of therapy that I practice, we talk about kind of the 3 steps of anxiety regulation. The first step is notice. So I have to see that I'm actually anxious. Many people may feel numb and tingly and not realize that it's anxiety. They may think they slept wrong or whatever. And sometimes it is sleeping wrong. I have to notice it. And then secondarily, I have to attune to myself. And so that means that I'm going to pay attention to breath holding. I'm going to pay attention to where I'm clamping. I'm going to pay attention to what's going on and work to learn to regulate myself through different regulating techniques. And only then can the third step happen, which is understanding. So all too often, the bully comes in trying to come up with explanations as to why you are or shouldn't be anxious or what's going on. But when our brains are offline with anxiety, we can't really think through or understand. We don't have to understand what's going on in order to regulate. So I would suggest that it's this noticing and attuning that is like unconditional love to ourselves. That if we can get to a state that no matter when the anxiety comes in, we say, wow, I'm really anxious. I don't even know why. All right, let me just check in. Let me take a breath. Let me regulate myself. And then I can start to look, try and understand, get clear about what's going on. But knowing the trigger is absolutely not imperative for being able to take care of ourselves with anxiety. And I think all too often, it's like we feel like we have to justify why we're anxious before we're willing to take care of ourselves. And I would say
Right.
that that's right. You may never know why you got anxious, and it's okay. You still
Right.
get to take care of yourself.
Can you walk me and the viewers through an actual exercise to disrupt the bully, aka the anxiety attack?
Yeah. So, again, first knowing what's my bully look like? How do I see it in operation?
Mm.
So, I think I may have told the story before of and almost any time I get up to present in front of other providers, I can get really anxious, and my internal bully is always like, they know all this stuff. You're not telling,
Mm.
it's like minimizes me. Imposter syndrome can come in.
Mhm. Mhm.
When I notice that, right, I can see it for what it is, and I can turn and say, okay, that's that mechanism.
Mhm.
I'm clearly anxious. And just separating from these thoughts being accurate and true and labeling it as those are anxious thoughts. Those are the thoughts that let me know, oh, I'm anxious right now.
Mm-hmm.
Then I can come to my body and I can do a body scan and I can say, okay, my jaw's clenched. I'm holding my breath. All right, let me take some deep breaths. Are you seriously having to do that? Right? The bully can come in. We can notice it. Okay, there is this bully that's coming in and trying to tell me not to be doing what I'm doing to take care of myself. I'm not going to do that right now. I'm going to attune to me and I'm going to take care of myself. So we have to have a really clear stance internally that says, no matter what comes up, no matter what thought comes up, if I am anxious and I can identify that I'm anxious, I don't try and understand it, judge it, know about it, philosophize about it. I attune to my body and I take care of myself and I regulate down, no matter whether I understand why it's happening or not.
Right. I understand that. Let's go to another Med Circle member question, please. Can morning anxiety also happen due to our subconscious while we are sleeping? For example, bad dreams that trigger anxiety or depression.
Absolutely. And this is common in PTSD and post traumatic stress disorder. They're
Mm.
often associated nightmares. And the nightmares are often associated with real trauma that's happened in the past. And so people can absolutely wake up in the middle of the night with panic, can wake up in the morning with panic. Their body has been stressed. And so,
It's kind of like when you wake up and you've had if Bridget, my coworker, was in my dream and she did something really to anger me, then when I wake up and I see her for the first time on Zoom, I might be like, oh, why am I so angry at you?
right.
And I'll go, oh, it was this fake dream that I had. That
Absolutely.
really displays the power of the brain, where this person in reality has done nothing to me, yet I am harboring negative opinions because of a dream that I had.
Yes, no, I'm laughing because I once had a dream that my husband was dating oh gosh, I'm blanking on her name,
Rude.
an old actress,
Yeah.
behind my back, and I woke up and I was angry with him. He's like, "What are you talking? And could you pick somebody else for me?" But I was really angry. And so, yeah, the power of our dreams, and man, can they feel lifelike, and especially if we've ever experienced something like that, it can be can feel really debilitating. And so there is something about that reality testing and grounding to understand it. And sometimes, a little warning for people, sometimes when we start to access feelings around traumas that we've really had, they do come up more in our dreams. We may have a little bit more anxiety. And this is really common for people who are first engaging with care, that often what we see is it's like, oh, I'm engaging in care. I'm starting to feel better. I'm taking care of myself. And then we start to do the work and it's like, oh, good God. Like there's a lot that I am feeling and there's stuff. And so, in our intensive outpatient program, we often see people feel better because they're engaging, they're getting sober. And then there's a dip and then there's marked improvement. And so that sense that nightmares coming up, more anxiety coming up in the midst of therapy is not necessarily a bad thing. It means that your nervous system is turning back on and you're starting to experience some things. So again, talking with your practitioner about these kind of things if they're coming up, because sometimes we can slow the pace or figure out ways to help ground a bit at the end of sessions to make sure that isn't feeling overwhelming.
Yeah. And even just being aware and knowing that, what peace can that bring? Dr. Lamb, fabulous to see you as always. Thank you for your insight. My two big takeaways: when we're looking at our thoughts, are they reparative or are they punishing? Critical question to ask. Second big one is this whole thing we're doing, mental health, living our best life, whatever you guys want to call it. This is not a purification process.
Absolutely.
Keep that on my notepad for the week. This is not a purification process. Dr. Lamb, I so appreciate you. Members, I appreciate you. It's Mental Health Month. So, be there for yourself, be there for those that you love always, but especially during this month. And remember, whatever you're going through, you got this.